Uh, Hello.
Yeah, sir, you can go live now.
Yes, yes. Can we start or already?
Sir, you can start. It is live now.
Okay. So, good evening, sir, and good evening, doctors. I will take this opportunity to welcome you all on behalf of Hetero Healthcare. My name is Chandrakant Maurya. First of all, thanking you for joining us today on discussion on the topic of Cariprazine, a novel antipsychotic treatment option in schizophrenia, and will be guided by Dr. Deepak Kelkar. And Sir, as you know about Hetero Healthcare, we are the largest R&D wings with having 360 solution provider, more than 25 years of excellence in multiple therapies, currently present in more than 126 countries worldwide, more than 200 products across various therapy categories such as HIV, AIDS, oncology, cardio, neurology, and distinction of bringing 4 biosimilar products to market, 36 plus state of art of manufacturing facilities, pioneering in quality and innovation. Today we are having Dr. Deepak Kelkar, who is a consultant, practicing psychiatrist, hypnotherapist, sexologist, and de-addiction specialist, having a huge experience of 41 years at Akola, owner of 2 psychiatry hospital and 2 multi-specialty hospitals. Sir is having a very huge fan following on YouTube as well as Instagram. There are more than 15 lakh followers on YouTube and 32,000 plus on Instagram, and founder and chairman of Sanmitra Society and Sanmitra Brand. So, Dr. Kelkar, sir, over to you, sir.
Thank you. Thank you very much, Chandrakant ji and all healthcare, Hetero Healthcare team. Today I'm not able to see the participants. How many participants are there right now? Participants? Because I'm not able to see the
almost
list.
10, sir. Almost 10 are there, sir.
10 participants are there. Okay, good. So thank you very much. Thank you for joining. Good evening, everyone, and thank you, Hetero Healthcare team, for giving me this opportunity to talk on this Cariprazine. Rushi can be muted so that there is no disturbance. Rushi Devakumbi. Yeah. So thank you very much for joining once again, and I am talking about Cariprazine. Sorry, Ciprazate. Ciprazate is the brand name for Cariprazine. And Hetero Healthcare has given me the opportunity to talk to all of you. So thank you very much once again. I'm just sharing the slides, PPTs. Just hold on for some time. Yes, Ciprazate. So it's a novel antipsychotic Cariprazine in schizophrenia. The Ciprazate is available in 1.5 milligram and 3 milligram capsules. And it's a novel antipsychotic, third generation antipsychotic, and very useful for negative symptoms of schizophrenia. So first we'll be seeing what are the positive and negative symptoms. So signs and symptoms of schizophrenia. This is not a new thing for everyone. Everyone knows this. Positive symptoms are hallucinations, delusions, disorganized speech and thoughts, and negative symptoms are anhedonia, avolition, and blunted affect. So in many patients we see cognitive symptoms also, like there are memory issues, inability to process social cues, and impaired sensory perception. And because of the cognitive symptoms, many times it so happens in my practice also, I'm confused whether this is an organic problem or whether this is schizophrenia. Organic problem is organic psychosis related to some brain problem. So that time, in that instances, then we have to apply our clinical judgment, and with trial and error, then we can differentiate, because many times it overlaps these cognitive symptoms of schizophrenia and organic psychosis. Symptoms of bipolar disorder. So there are manic symptoms and there are depressive symptoms. In manic symptoms, there are racing thoughts, inflated self-esteem, extreme talkativeness, reduced need for sleep, feeling of euphoria, and risky behavior. In depressive symptoms, as we know, everyone, persistent low mood, fatigue, tiredness, fatigue, low energy, loss of interest in activities, lack of pleasure, lack of concentration, uncontrollable crying without anything. Person starts crying, weeping. Either sleep is increased or decreased, appetite increased or decreased. So sleep and appetite problems are there. So there are manic symptoms and depressive symptoms of bipolar disorder. And as you know, this Ciprazate will be of help in both. So as everyone knows, first generation are typical antipsychotics. And when I started my practice in 1983, and I was in Nimans, when I went to Nimans, Bangalore, for interview there, the first question which was asked to me, what is the dose of chlorpromazine? So chlorpromazine that time was a drug of choice. These days nobody uses chlorpromazine. So it was a drug of choice, and still I remember my reply on which I was selected. I said it is 100 milligram to 400 milligram per day, chlorpromazine. Very good. Then flubentazole, haloperidol, trifluoperazine. So they are the first generation or typical antipsychotics which we are using those days. 1979, 1983 till 1991 or 2. 91, 92, I think olanzapine came. So till that time we were using all these typical antipsychotics. Then second generation are atypical antipsychotics. And in this the following medications are atypical antipsychotics, and these are amisulpride, aripiprazole, clozapine, lurasidone, risperidone, olanzapine, quetiapine, and paliperidone. And all of us use these second generation or atypical antipsychotics because there are so many benefits of using this. But still, haloperidol is haloperidol. The effect which we get for positive symptoms with haloperidol is they can't be matched with all these atypical antipsychotics. So types of antipsychotics if we go to is the first generation, second generation, and third generation. And the Ciprazate, Cariprazine is in the third generation antipsychotic. The first generation antipsychotics are dopamine receptor antagonists, mainly targeting D2 receptors. And in this we have got chlorpromazine, phenothiazines, then butyrophenones, haloperidol, thioxanthines, clobenthixol, dihydroindolons, melindone, and dibenzethines like loxapine. Now nobody, I think very few people use, I think loxapine and chlorpromazine. I think chlorpromazine is used by very few people now, few psychiatrists. I use chlorpromazine as combination of chlorpromazine with trifluoperazine and triziphenidil. This fourth type, so for sleep. Then second generation antipsychotics. They antagonize serotonin 5-HT2A receptors and antagonize D2 receptors. They are second generation. And in this we have got risperidone, paliperidone, ziprasidone, lurasidone, clozapine, olanzapine, and quetiapine. I think everyone uses all these types. These drugs are used very regularly by everyone. Now the third generation antipsychotics are D2 partial agonist, and depending on the dopamine concentration can have antagonistic effects on dopamine receptors. And in this aripiprazole, brexpiprazole, and cariprazine. So they are the third generation antipsychotics. And with this topic we are talking about is cariprazine today. As we all know, there are side effects of atypical antipsychotics, and most likely we will see weight gain and diabetes. In descending order, if we see clozapine, descending, olanzapine, quetiapine, risperidone, ziprasidone, aripiprazole. So weight gain and diabetes is most common with clozapine and olanzapine. And then we are handicapped when a obese patients comes to us, and then we can't prescribe olanzapine or clozapine, or in diabetic patients. So then we go for risperidone. For risperidone, again, there are side effects. Movement effects like tremor, stiffness, agitation. So in descending order, again, risperidone, olanzapine, quetiapine, ziprasidone, aripiprazole, and clozapine. So with clozapine, there are least tremor, stiffness, or agitation. Actually, clozapine causes a good sedation. Sedation, sleepiness, and low energy. Again, the clozapine is at the highest level. First comes clozapine, then olanzapine. Olanzapine also causes sedation, and quetiapine. Then less with risperidone, ziprasidone, and aripiprazole. Decreased sex drive and function, missed periods, discharge from breast. Now these side effects are more with risperidone, olanzapine, quetiapine, clozapine, and ziprasidone, again in descending order. So you can take photocopy of this. Take a picture so that you can have all these in your existence. So now we'll talk about cariprazine, its place in therapy, and patient characteristics. So the panel members indicated use of cariprazine in patients with a wide spectrum of presenting symptoms or conditions. And cariprazine was most often prescribed for patients presenting with their first episode of psychosis. In general, these tend to be younger patients. The first line candidates for cariprazine are those with predominantly negative symptoms and those with metabolic symptoms. So, like cariprazine is most commonly was used and is used for negative symptoms. And it is very essential, very good thing, because I find in my practice also, there are so many people, patients, like they are brought after 4 years, 5 years of schizophrenia, they have piles of files, and all treatment has been taken, and now they have got negative symptoms. Like वो हमारा बेटा बाहर निकलता नहीं है, sits in the house, isolated, doesn't go out, doesn't mix with anyone, at times laughs to self, doesn't talk, doesn't work. So all negative symptoms, and doesn't mix, doesn't eat at home, or he'll cook himself, and is not working. So there are the negative symptoms which are most commonly seen, especially from the villages where people don't treat patients for, either they don't treat at all, or they take inadequate treatment, or patients they refuse treatment and they become chronic schizophrenics. So I think in these patients, cariprazine will be of good use, good help to us. So approved indications are treatment of schizophrenia and acute treatment of manic or mixed episodes associated with bipolar disorder. Now, what are the dosage and administration? Dosage forms and strengths, capsules are available, 1.5 milligram capsule and 3 milligram capsule. And for schizophrenia, the starting dose is 1.5 milligram per day, and you can increase slowly, gradually to 6 milligram per day, depending upon the clinical condition and the effect. So 1.5 milligram to 6 milligram per day. And bipolar mania, 1.5 milligram per day we can start with, and then we can increase from 3 milligram to 6 milligram per day. It can be administered once daily with or without food. So mode of action. Mode of action of cariprazine is a partial agonist at D2 and D3 receptors with significantly greater affinity for D3 receptors. Partial agonism at 5-HT1A receptors. Remember, antagonism at 5-HT2A and 5-HT2B receptors, and minimal antagonism of 5-HT2C, 5-HT7, and H1 receptors. Because of these characteristics, cariprazine is useful for negative symptoms. Now, role of dopamine receptors. And what happens with cariprazine is antagonism and partial agonism of dopamine D3 receptors can mediate improvements in social interaction, anti-anhedonic and pro-cognitive effects. D3 antagonism in the midbrain can increase dopamine neurotransmission to the prefrontal cortex and the nucleus accumbens, reversing hypodopaminergic functioning, which has been linked to negative symptoms and mood deficits. So mostly, the negative symptoms, they are mostly linked with what? The negative symptoms are mostly linked with hypodopaminergic function. And here, what happens is dopamine neurotransmission to the prefrontal cortex and the nucleus accumbens increases with this cariprazine. The increase in dopamine in the prefrontal cortex could activate D1 receptors, which in turn could further mediate improvements in cognition and negative symptoms. So the whole role is of D3 receptors. D3 receptors are also known to increase acetylcholine in the prefrontal cortex and regulate glutamatergic excitability. So now we'll see different types of antipsychotics and their affinity for receptor types. So this is the list of atypical agents on the left hand side, and on the right hand side in the columns D1, D2, 5-HT2, alpha 1, M1 and H1 receptors. We can take a picture of this. So atypical agents are aripiprazole, asenapine, brexpiprazole, cariprazine, clozapine, iloperidone, lurasidone, olanzapine, paliperidone, quetiapine, risperidone and ziprasidone. And here their affinity, if you see, cariprazine is in the third row. D2 receptors and 5-HT2, that is the most site of actions. Aripiprazole, same, more or less. So aripiprazole, cariprazine, iloperidone, but iloperidone 5-HT2 receptors more is there, So olanzapine, paliperidone, so all these, you can take a picture of this. So cariprazine, receptor D3 partial agonist, and because of these clinical effects, if you see the right hand side, right column, right hand side column. So because of D3, D2 action, D2 actions, improvement of positive, negative and depressive symptoms, pro-cognitive effects, improvement of positive symptoms, improvement of negative and depressive symptoms, lower risk of extrapyramidal symptoms, improvement of depressive symptoms, pro-cognitive effects, improvement of depressive, all these things, receptor activity and the clinical effects. So more or less, if we look at this, so improvement of positive, negative and depressive symptoms are there with cariprazine. So the property of the D3, D2 partial agonist accounts for improvement of psychotic symptomatology with little or no adverse effects, such as extrapyramidal symptoms or hyperprolactinemia. So what are the key advantages of cariprazine? So key advantages are less weight gain, no significant increase in QTC interval, once daily dosing, absence of prolonged titration periods, minimal anticholinergic, metabolic and prolactin related side effects, effective in negative symptoms where many antipsychotics they fail. So many antipsychotics they fail in negative symptoms. In most of the times, in my practice, what I do is for negative symptoms, I use modafinil. Modafinil or escitalopram. Now we have got a choice now to use cariprazine for negative symptoms. Somebody is making noise, so can you please mute the person where the noise is coming? Okay, good. Then see the clinical trials. So what are the clinical trials? Clinical trials are many, and cariprazine has antidepressive properties potentially due to its high affinity for D3 receptors. This is a clinical trial, and in this 1.5 to 4.5 milligram per day was given, and it improves the MADR score. And it was as compared to placebo. The studies were conducted, MADRS remission rates were improved with cariprazine. So antidepressive properties are seen. Then cariprazine, a broad spectrum antipsychotic for the treatment of schizophrenia, pharmacology, efficacy and safety. This study was conducted. So cariprazine has also shown broad spectrum including cognitive symptoms, negative symptoms and function. In all those clinical trials, cariprazine was generally safe and well tolerated in patients with acute and long-term exposure. There is also another study, cariprazine in acute exacerbation of schizophrenia, a fixed dose phase 3 randomized double-blind placebo and active control trial. This is Durgamesh et al. Study. Patient were randomized for 6 weeks. 6 weeks trial, a double-blind placebo and active control study was done. This clinical global impression severity of illness score, cariprazine 3 and 6 milligram per day were also associated with significant improvements related to placebo in CGI scores. Then cariprazine, the treatment of acute mania and bipolar disorder, bipolar 1 disorder, a double-blind placebo-controlled phase 3 trial. This is also study available. Least squares mean change from baseline to week 3 in young manic rating scale total scores. This is also study available for cariprazine. So in summary, number one, it is less sedative, less extrapyramidal symptoms, no change in QT interval, less incidence of hyperprolactinemia, which is very disturbing side effect with risperidone, which I have seen in my studies, in my practice. Anxiety is less compared to aripiprazole. No changes in weight, better metabolic safety profile, and high rates of relapse prevention. So thank you very much. Thank you for listening and thank you for contributing. Thanks a lot. Yeah. So anybody, any comments, anything? Yes, please.
We're waiting for the questions, sir, on chat box.
Yeah.
So as of now, no queries, sir.
No queries. This is a good thing, good antipsychotics. Today your person came to me, I also asked him to make it available, and I think it is quite promising, yeah, quite promising drug.
I will drop some queries.
I think questions are started coming from the doctors. So I request Chandrakant sir to address each and every questions to present.
Yes.
Sir,
so Navid Deshmukh has asked the question, OD or BD dose? It's a OD dose, Navidji. Dr. Navid, it's a OD dose, once daily dose. And
so the question is that OD or BD dose? First question.
Yeah, it is a OD dose, and to begin with, it is 1.5 milligram per day capsule. And the other question is how we different. Sorry, what is the highest dose? It is
What
6
is the
milligram.
maximum doses
Maximum
of cariprazine in any symptoms, and how we differentiate in any symptoms?
So
How we
one
differentiate
time,
in terms of side effect profile aripiprazole versus cariprazine?
yeah.
Can it be given in positive symptoms?
Yeah. So it can be given in positive symptoms also. In positive, the studies are available. Like in positive symptoms, cariprazine was helpful and it is beneficial. The dose is single OD dose 1.5 milligram to 6 milligram, available in 1.5 milligram capsule and 3 milligram capsule. So we can give 3 milligram per day, or then if you want to give 6 milligram, you have to give 2 capsules. And if you give BD also, no problem.
Yes. Sir, can it be given in positive symptoms? That is
Yes.
next question.
Yeah, definitely. Like studies are there where in positive symptoms also cariprazine was useful and it showed good effects in controlling positive symptoms also. So it can be used in positive symptoms also. And first line of treatment. Not necessarily that we have to give some other thing and then second line, no. We can start with cariprazine straight away.
Sir, next question is in MDD, which antidepressant is suitable with cariprazine?
That study I don't have right now. If Chandrakant, if you have got any study, Chandrakant Maurya, if any study like this is available, any controlled study, I don't know. I don't have any study like this.
Devendra sir can answer.
Yeah, Devendra sir can answer.
Devendra sir.
I think he's not there.
Sir, we'll hold this question.
Sir,
We'll
we
go to the
more details
No
on
worries.
this. So currently details is not available, sir.
Yeah.
Okay. Sir, we'll go next question. Can it be replaced with, can it replace aripiprazole?
Yeah, it can definitely replace aripiprazole. And I think third generation antipsychotic. Aripiprazole is third generation antipsychotic. And more or less the action is same. So, and like as it is now claimed that cariprazine is useful in negative symptoms also, so it can replace aripiprazole in due course, maybe.
Okay.
Yeah.
Sir, next question from one doctor. Use during pregnancy.
Yeah, again it is not available, this study, like whether it can be used in pregnancy or not, what are the effects during pregnancy on the fetus. The studies, I think they are not available right now.
Okay.
I don't know that. Yeah.
Next question from one doctor. How we titrate cariprazine in negative symptoms?
This trial and error, like we can start with 1.5 milligram and then slowly raise to increase to 6 milligram per day. So it's a trial and error. I think with 3 milligram per day dose, you can get the effect. Will get good effects with 3 milligram per day.
Okay. Next question is, sir, also can it be given positive symptoms?
Yeah, that I answered. It can be given positive symptoms.
Okay.
And there is no need to give second generation antipsychotic. Straight away you can go ahead with the third generation, that is cariprazine.
Okay. Thank you, sir. You have answered all the questions except one, which is in MDD, which antidepressant is suitable with cariprazine. And just because of we don't have any data, we cannot answer it. So
I think it will come definitely.
Sir, one question came again. Any specific side effects?
Very less side effects, not specific, like no specific side effect as such. You know, akathisia is not seen with this. Akathisia, not seen with cariprazine.
Okay, sir.
Yeah.
Sir, thank you very much for your valuable time and your guidance towards entire delegates. So thank you, sir.
Thank you very much.
Very much informative and Also, thanks to all the delegates and the attendees for their patience listening and their contribution. So thank you, sir. Thank you very much from entire team of Hetero.
Thank you.
Thank you, sir.
Thank you so much, sir.
Yeah,
Thanks a
very
lot,
much.
doctor.
Thank you.
It was very wonderful session and learning session.
Thank
Thank you.
Yes,
Thank you,
we'll
thank
meet soon. We'll meet.
Yes,
Thank
sir.
you.
I will
Yeah,
I will
sure,
be
sir.
there, sir.
Yes.
Yes.
Okay.
Okay, sir. Bye.
चलो झालं.